In figures that could reflect a worrying trend, the daily COVID deaths in India have doubled since the 1st of June. In fact, have more than doubled since the 1st of June. So why this trend? What does it tell us? Is it a cause of worry? And what is the government doing about it? Let's find out in Government Matters today. I have with me Avantika Ghosh, who, as you know, covers health for ThePrint. Start sending in your questions right away. We are live with you. Avantika, so first just give us some numbers, tell us what has happened, what do these figures look like?
So on the 1st of June, the number of deaths that happened that day was 204. And yesterday, as in the number that was updated this morning, that number is 500.
So more than doubled.
More than doubled, and it's a steady rise, except for one day in between on 16th of June when some pending numbers were updated in some states. It's been a fairly steady and even rise. So if you plot a graph, it looks pretty straight. But the point is, but still the deaths have doubled.
Right.
And deaths are a problem because a lot of times it could signify that your patients are coming late to you. Medical attention somehow has been delayed.
Correct.
Your messaging may not have been correct. While there are other things, I mean, somebody who's been to the hospital on time, somebody has got medical attention on time, can still theoretically die. But one of the things at a public health level, at a community level, is that if there are deaths happening, then you have to look at getting people to the hospital faster.
Right. So, Avantika, what does it tell us? Is it also possible that earlier the death figures were not being reflected correctly, that perhaps, a lot of deaths were being ascribed to, say, the comorbidities and not to the fact that the death was because of the complication that the comorbidities caused due to COVID?
Actually, I was talking to some experts right now, and epidemiologists are saying that it is not so much the doubling of numbers, but the profile of the dead that is the worrying factor here. Because in India, unlike anywhere else in the world, almost about 47% of the dead are people aged less than 60 years, whereas the world over it's about 90% which is aged more than 60 years. So in our case, it's about 53% dead in that age group, in the above 60 years age group, whereas in the global trends, it's about 90%. So what they are saying is it looks far more likely that you're missing deaths in the elderly age group. A person in say an urban slum, an old person in an urban slum, he may not, because you've made it so complicated in the sense that there will be a sanitization, there will be, he or she has to be in quarantine and all that. So it's possible that that person is not seeking the medical help that he should have, and that the person is dying at home and we have not accounted for it. The other factor that, again, and this NCDC officials are telling me, is that this very strange figure of 43% Indians dying without any apparent comorbidity. They are saying what states are simply doing is that to keep death figures down, if you say have diabetes, you have heart disease, you have hypertension, they're simply in the reason for death, even if you're COVID positive, you're putting the comorbidity, which probably reflects this number, because this number otherwise is very worrying. But this can only happen if you're undercounting the COVID deaths by attributing them to comorbidity.
Right.
So, so those are some of the, more than the numbers per se, it's the profile that is worrying. That's what experts are telling me, and even within the government, some people are saying that there's a problem here.
So how is the government planning to address this? Surely they've taken note of the issue.
So one of the things, NCDC is actually the National Center of Disease Control, which is the apex body that deals with infectious diseases, tracking, tracing, etc. One of the things they're pushing for is they are saying, why don't states report all deaths to us? Instead of, just COVID deaths or just infectious disease deaths, report all deaths to us. Let us analyze and let us see whether some of those deaths were missed COVID deaths. Give us that kind of leeway, basically.
Right.
That's one of the things. The other thing that they have been doing, and that's been on for a long time, every kind of public messaging, they have been saying that please seek medical help, please watch out for symptoms like breathlessness, please do not neglect, please do not, if you think you're unwell, please do not feel shy of seeking medical care, because that could mean the difference between life and death. So that's the sort of things they are constantly saying, because say in a city like Bombay, there's a problem, because the average hospitalization, the number of days to death, that was very little, which showed that you were probably getting patients less. Because
being treated on time.
Yeah, and in a city like Bombay or Delhi, there is no problem of infrastructure. Availability should not be an issue.
Right.
It's probably just that people are coming late.
Right. So, Avantika, we'll start taking some questions. There's a question from a handle called Goblin 1216. What impact will airborne transmission of COVID-19 have on the way we are tackling this pandemic? Because, so far it was mostly surface, etc., and suddenly this airborne transmission has come to light.
So this is actually the question we had asked the government last week, asking that how do you plan to factor this into the control measures? And what we were told is that it's already factored in, because if you maintain that 6 feet distance that they're talking about, the 2 gaj ki duri, then this actually takes care of airborne transmission also.
Masks as well,
but also if you maintain the distance, the prescribed distance, that mask, obviously, I mean, mask is it's mandatory everywhere, but even this distance should sort of take care of airborne transmission. Also, I mean, airborne transmission does not mean that it just comes.
Right.
It travels indefinite distances. It doesn't work like that. It has to be a finite distance that a droplet needs to travel and reach a person.
And enclosed spaces, etc.
Enclosed spaces is a problem, because then that distancing is a problem. But otherwise, airborne transmission strictly doesn't mean the way, say, TB transmits. It's not exactly like that.
Right. Abhimanyu Sinha, shouldn't we expect the death toll to rise sharply in any case when the number of active cases has been rising in every corner of the country?
Yes, absolutely. Death numbers are supposed to rise, and that's actually one of the worries, that it has not risen enough. It's the numbers are less. Your death profile is the profile of the dead is problematic. It's very different from the rest of the world, and the numbers have not risen to the extent, at least in some ages and in some sections of people, the numbers are not as high as elsewhere. So that is, there's a skew. That skew is the problem.
So
here.
we could be underreporting the deaths.
We could be underreporting the deaths majorly.
Right. Adityan Cheruseri, would the situation have been different if states were given greater autonomy in dealing with the pandemic in relation to quarantine rules, requiring passes to cross borders, etc.? So did the centre deal with it with too much of a heavy hand, too centralized manner?
That's sort of eased now. Now it's states who are deciding. States are deciding lockdowns. States are deciding how much to allow. So the thing is, there is a central guideline which you cannot relax. That's the rule. That still is the rule.
Right.
That you cannot dilute that guideline. But you can make it more
stricter.
stringent, and people are doing it. States are doing it. State after state is, and even in terms of interstate travel, West Bengal has stopped all travel.
Right.
No air travel between train
cities.
travel between Bombay, Delhi, because of the rising numbers of cases here. So what you're saying may have been applicable at the start of the pandemic, but right now I think states have quite a bit of leeway in deciding how they want to.
UP is doing this weekend lockdown on its own.
Exactly, UP is doing weekend lockdown on its own. So that's all states are taking different kinds of steps, and they're taking it on their own.
Right. Prabhanath Nair, how true is this scientifically that the COVID virus will decline on its own as time goes, as time passes?
That only the virus can tell when it will decline. What we can tell is that as time passes, as more and more people get infected, there will be herd immunity, and then transmission will probably go down.
Right.
How much is the base, how much of your population needs to be infected before that herd immunity is achieved is the big question right now, because in countries like Sweden, which tried this herd immunity theory, they ended up having massive deaths, massive infections, but they're nowhere close to herd immunity yet. So whether the virus dies down is actually, it'll just be sheer good luck if it
I think a vaccine is the best bet.
Vaccine is the best bet. Herd immunity, those are the two things that can get you through.
Right. Abhirup Bhattacharjee, are you noticing any improvement in medical infrastructure in the country besides what we've seen in Delhi and Mumbai?
I suppose there is much more readiness now, even if the infrastructure per se may not be permanent, but there's much more readiness. There are also these railway coaches, and that they haven't, that uptake hasn't been that much. So if that hasn't been that much, then the sort of the logical conclusion then is that people have enough, so they don't need these coaches.
Right.
Also, it's primarily a big city problem, and big cities usually have infrastructure. Even though Delhi kind of started running out, and Delhi had to have these coaches at Chakurbasti, but big cities are usually better off, and small towns have not seen that kind of a spurt yet. Even when migrants went and people thought that there will be a huge spurt in small town, that did not happen.
Right.
So infrastructure wise, I think the uptake of the trained coaches could be one indicator of whether they are sufficient or not.
Right. There's a question from Varun Sharma. Will the virus being airborne affect the death rate greatly? So I think there is a lot of concern about this airborne question, Avantika, because as I said, this is a new phenomenon that we are talking about. So can it, I mean, I'm not sure whether it can have an impact on the death rate, but can it, is it responsible for the increased numbers that we have seen?
So the increased numbers, we can't yet say. Actually, even this airborne it's just a hypothesis.
It's a theory.
It's just a hypothesis right now, and WHO is saying that yes, it is possible, but whether that is actually happening or not, we're not clear. Also, even if it is airborne, I don't think the outcome will differ. What will differ is the number of infections, but I don't think the death rate per se will go up because of this transmission.
Right.
The mode of transmission should not matter.
Correct.
The death rate is a function of how soon you address a patient, how much infrastructure is available, how easily the patient reaches the hospital, those kinds of things.
And what the patient is already suffering from.
Right. So I don't think that would matter.
Right. This question is from Kritika K. Why aren't governments letting people take voluntary antibodies test?
To what end? Antibody test would not actually, we don't know if that is an immunity passport, if that's the purpose of the question.
Right.
We don't know, because there are several studies which are saying that the antibodies don't last beyond 2-3 months. So even if you have antibodies today, at least theoretically next week you may not have antibodies, so that immunity passport function is gone. Secondly, and I think this point has been emphasized in so many fora, I don't need to say it again, but as something to find out infections with, the antibody test is not a gold standard by any distance.
Right.
Even the antigen test probably is slightly better. The antibody test doesn't tell you anything. It just says that you did have an exposure to the virus. At what time you had it, whether that antibody will remain in the future, none of that. You can't even tell that, okay, you had this exposure in March, so maybe you won't have the antibodies in September. Even those kinds of inferences are not possible.
Right.
So
doesn't quite serve the purpose.
Yeah, so to my mind, antibody test would not serve any purpose other than for scientific investigation.
Right. Pranay Bhagat, is the weather playing any role in increasing the COVID deaths? It is said that the deaths will be more in November. To what extent is it true? So let me just change the question a little bit, because I don't think the deaths would have anything to do with the weather, etc. But there was, but does the weather impact the transmission of the virus in any form? Yeah,
so that's one of the theories that the government of India is functioning on, because monsoon is all over the country right now. They're saying that because of the higher humidity in there, the droplets will be bigger, they'll stay longer. So it'll take longer to dry up, basically. So they are looking at a spurt. Even the Prime Minister, when he addressed the nation a few days back, he mentioned this apprehension that monsoon will actually make infections worse. But whether that has happened or not, we don't know. Infections are going up, but infections are going up as per the trajectory that has happened, that has been there so far. Whether that rise is happening because of monsoon or not, I don't think we can come to that conclusion yet.
Right. There's a question from Shashwat Srivastav. According to the Delhi Deputy CM, which is Manish Sisodia, there would be 5 lakh cases in Delhi. Do you think we are heading there, or has it been controlled? So, of course, this became a bit of a controversial statement, after which Home Minister Amit Shah said he stepped in because, this created panic, and these figures seemed baseless according to him. So, where are we right now in Delhi?
Yeah, so we are still very far from 5.5 lakhs. But see, the numbers, even if we are looking at a number like 5.5 lakh at some point of time, this is a disease that spreads very easily. What we need to look at also is that just the number doesn't tell you a story, because 69% of all cases in India have been mild or asymptomatic.
Right.
A lot of those people don't even know that they have the virus.
Right.
So to plan based on such a figure will actually unnecessarily create panic, and it will not add to anything at the policy level, because essentially you don't have to prepare for that number. You have to only prepare for that small percentage, maybe 10%, 12% of these cases who need attention, who need medical attention, who need. So I think a lot of the discussion is being diluted by this overwhelming focus on numbers.
Right.
No, we have over 8 lakh cases. I mean, what numbers are we talking about in the country right now? So I think we need to sort of change that a little bit.
Right. Mukesh Mishra, considering the ICMR comes up with new parameters every now and then, how do we really know when the situation is improving? Not just the ICMR, every other day we hear a new hypothesis or a new theory, the WHO says something, other scientists say something. So does anybody really know anything about the virus in terms of what is going to happen?
I think people have a fair idea, but if you have to make like a absolutely ironclad prediction, like this 5.5 lakh thing, an ironclad prediction is not. We have a fair idea of how the virus behaves, how it transmits. We cannot really be crystal gazers, because the virus has a mind of its own. The virus has, it's as Dr. Pratap Reddy told us in Off the Cuff last week, that this virus is behaving very strangely. So a lot of the planning and everything, a lot of our understanding comes from our understanding of SARS and MERS coronaviruses. But this virus certainly is behaving very differently. So I would say yes, people do know, but that knowledge is evolving.
Well, what the virus does, only the virus knows.
Yeah.
Fuderzo, considering vaccines need enough gestation period to understand its long-term side effects on people, who will bear the responsibility if the vaccine starts showing side effects in the long term? Also, because we're talking about the gestation period and the understanding of a vaccine, where are we on the ICMR claim of a vaccine by the 15th of August?
No, so ICMR has now said that we just, even last week when there was press briefing, ICMR reiterated that. They said that we did not want India to miss the vaccine bus. So that is why that letter went out, and when we persisted with our queries, the Health Ministry representative actually said, I'm quoting him, do not read into Dr. Balram Bhargav's letter what was not written. I'm not sure what he meant, because the letter clearly said 15th August. But I think that's been a bit of an egg on ICMR's face, and they are kind of
now
trying
they don't know how to
wash their hands
scrambling
off.
Avantika, before we close, let's just talk a little bit about the positivity rate and where we stand on that right now.
Yeah, so the positivity rate is, it's basically the number of positives in the total number of samples. So when we look at the daily positivity rates since June 1, the weekly rates at that point of time between 2nd June and 7th June were about 7.18, and this week it's above 9 actually. I think 9.3, 9.2, 9.3 this week. So that number has been steadily going up, and what I need to say here is that both WHO and the government of India say that keep the positivity below 5. That's the official, but unofficially most people agree that if it's below 10, we are comfortable. But now we are gradually breaching. I think that's the thing, and this has happened with the doubling of tests between June 1st and now. The tests have more than doubled. Despite that, the positivity rate is constantly going up, which means that the pandemic is spreading. The incidence of the infection is going up. We need to test more perhaps. Yeah, so that's
also why this figure is important is because when you compare just absolutes and say the number of cases have gone up, it's also because of the number of tests that have gone up. But this tells us in relation to the tests, so this rate is very important in terms of telling us how the virus is progressing.
Exactly.
Well, thank you so much for sending in your questions for Government Matters. Avantika, thank you so much for walking us through this very important data and for explaining where India really stands as far as the fight against COVID is concerned. Thank you.